study medicine in an African country, Africa. So in Africa, we have a number of schools or countries that have medical schools, which already we have some Eswatini studying there. Of course, South Africa is the first, but you should take note that South Africa has become highly competitive because they are also trying to increase the numbers of Africans or blacks who study medicine. So they have quite a big number of high demand for medicine. But we also have some of our students who have gone to Malawi. Malawi has a School of Medicine, University of Malawi, University of Zambia. They have School of Medicine. Namibia, University of Namibia, or UNAM, has a School of Medicine. University of Botswana, or UB, has a School of Medicine. Then we have, as we go up in Africa, we have Tanzania, which has a number of them. We have Kenya, which also has a number of medical universities. And Uganda has quite a number. You go up, up to Ghana. I'm not sure about Nigeria. I wouldn't recommend Nigeria because it's so hectic, but if you get to study there, it's still okay, but you really need to check before you get the acceptance letters. You need to check with us if that university is recommended by our Swaziland Medical and Dental Council. So I also work with the council where there is a registrar who looks after issues of doctors. So in Africa, those are the ones that I've mentioned, which you can apply to. But as you apply, I always encourage that you contact us. I will leave my number. I don't mind you asking me any questions, but don't forward me things because I'll leave my number for WhatsApp. So anytime you are getting a response from a university or you want to apply, just send me a message. I'm one of those who was there in the briefing at the library. I'm getting this offer. Is it okay? So that you are guided properly. But there are some universities outside Africa where people are studying currently. We have quite a number who are studying in Cuba, but in Cuba it's a scholarship between the two governments, the government of Eswatini and the government of Cuba. So that one usually is just a few people. I don't know how labor chooses or selects. There's that one. Then there are universities in Russia where a number of our students have gone, but those ones the parents are paying. So the government, maybe we'll come to the scholarship, but I can as well cover it now. The government scholarships will usually cover the African countries. So if you now want to study in Europe, Russia, America, wherever, you may find you have a problem with scholarship, except Cuba. Cuba, there is an agreement for scholarship there. And also, we also have others studying in Ukraine on self-sponsor. So self-sponsor is Russia, Ukraine, Turkey, whatever, Cyprus, all those countries, you have to self-sponsor. But when the countries that have agreements with our government, I repeat, is Cuba and Taiwan. Now Taiwan is different again. Cuba can take you straight from high school. Taiwan would want to take you with a first degree, whether it's a health-related degree, whether it is degree in nursing, degree in Bachelor of Science, or a degree in environmental health. So those are the countries and some of the universities I've mentioned, but largely you go online and look at those countries and look for medical universities in Zambia, then it will show you which ones you can apply. But some of the universities are private. So that's why be careful, because some of the private universities may not be approved by the Medical and Dental Council. Then you come back and everybody's like, but this university is not registered for internationally to provide that course. So don't be surprised, some people open those kind of universities without following proper procedures. And then, of course, entry requirements. even here there's a variation. Number one, some universities will allow you to come in with an O-level, and if you've passed very well, they will make you write a test, an aptitude test or entry-level test, and then they'll decide to take you in. Some of the universities are strict. They want A-levels. East Africa, the whole East Africa, Uganda, Kenya, Tanzania, all those countries, they want you to come with A-level or a first degree, bachelor's degree. But some countries like Botswana, when you apply, they will tell you that they offer a 1-year pre-med course, pre-medicine course. So it depends now with the university. So when you reach that site and you put in your application, the guidance will come of what is expected from that university. So depending on which university, there's no standard. But otherwise, most of them will want a higher level of high school and good grades. So when we say good grades, we mean what? You need to have C or better in maths, in physics or physical science, which is physichem, biology. Usually, maths is an added advantage. I think English, of course, you have to credit it. So usually they just want the sciences to be passed with a C or better. Then usually what they do, they will take your grades and they give what we call points to your grades, and then they will come up with a total. If you've got maybe 40, the cutoff point is maybe 40, for example, then they give points to each grade, then that's how you end up passing through the cutoff points, or falling below it, and maybe being rejected. Okay? Okay, so what are the pros and cons of studying medicine abroad? Like going to Russia, going to Ukraine, Cuba, and all that. The non-English speaking countries, Cuba, they study in Spanish, pure Spanish. So the few Cuban doctors who've come back are so fluent in Spanish, you even just wonder. Then in Russia, they'll study Russian first. So there's a 1 full year of studying the language and the culture, because everywhere you go, you'll find that language. So that is one of the pros and cons. Maybe it's a con, maybe it's a pro, I don't know. Because now you have more languages, it's a pro. It's a con because there's an additional year. The other issue with highly developed countries abroad, studying there, is you find that you are not trained in the third world or developing countries' health problems. So, for example, if you talk of Africa, there are specific problems that are in Africa. There's malaria in Africa. There's high HIV in Africa. There's high TB in Africa. There's high diarrheal diseases, pneumonia. Children are still dying from diarrhea, pneumonia, which doesn't happen in the Western world. So when they train there, they will have their specific focus on certain things that are a problem to them. Like in the USA, maybe they'll focus on cancer. Okay, we do have cancer now here, a lot of it. But you'll find maybe they are focusing on certain conditions that are not common in Africa. And then when you come back here, you find that you are just dealing with basic conditions. But of course, it doesn't mean that you cannot learn as you work. You will learn through being placed within the country after graduation. So it may become a little bit steep for you to adjust, but you will adjust eventually. So because ultimately medicine is one thing. It's trained in the same way. The language is the same. We use the language used is English language. Like Italian languages. So I
Latin.
Yes. So all the words in medical terminology follow the Latin kind of words. so they are similar. So those are the pros and cons, of course. Apart from just the language, it's the kind of diseases that we have. But it's not a train smash, you can learn. And then there is we've talked about it, studying in Turkey, Taiwan, Russia, Ukraine. We don't have Poland yet. So the countries that I mentioned are the ones where our graduates are coming from for now, which I've already mentioned from Africa and from abroad. So the scholarships. Logunya, you will ask me the questions. Let me just quickly go through so that I give you time. So the scholarships that are available is the government loan scheme. The government loan scheme, this means that Ministry of Labour will have a number of scholarships for medicine. And medicine, from what I know, is still one of the priority courses for sponsorship by Ministry of Labour. Why? Because we don't yet have a medical school in the country. Even if we had, I think they would still sponsor it. But it's still among those which they sponsor for external, for outside. Then there's another scholarship for the Taiwan, which means you have to have a degree for that one. Then there's the scholarship for Cuba. So from what I know, all the people training in Africa, government is funding them. There's one from Ghana who is still studying. I think she's finished, she's doing her internship there. And then there's others from Botswana, Namibia, quite a number. So government is funding those local Africa-based courses. So what other careers are there besides medicine? Because all of us are thinking medicine when we think of health. So health is really a huge field, it's dynamic. So apart from this, we have different departments where you can have an entry level. So locally now, of course, there are nursing courses, which we have. Then we do training in lab technology at SANU. You can also select pharmacy at SANU or pharmacy technician at SANU, and also pharmacy at Christian University. We also have radiology or radiography. Radiography, which you can enter from entry level, is also very important for us. And others which may come up in the future, like radiation therapy technicians, which are coming up for when we treat cancers in the country. I think you can ask more, but there are other courses that can be done. So most people, you find that if you can't make it to medicine, also start thinking about the other areas that you can go in, because they're equally interesting to work in. The gaps in the market, we do have huge gaps. If I look at our health sector in the country, we do have huge gaps. Unfortunately, we have a freeze on hiring, but the freeze doesn't mean that we don't need experts or expertise, such as medical expertise and others. So employment trends for now is that we are frozen and we are not allowed to increase the number of posts. But we keep pushing and add a few more, and then people get into the system. But otherwise, in previous years, we used to just, if you come and say, I finished medicine, I need a job, you just create a post and you enter. But now we can't, because the creation of posts is not done by the Ministry of Health. It is done by the Ministry of Public Service. So we just present our request and they will look at the budget and then they'll say, no, not now. You wait a little bit. So that's why you find that there are problems, too many patients compared to the number of doctors, and then long waiting queues, people complaining, So those are the dynamics that we see currently, but we hope that this trend is not going to continue, that at some point we will reach the level at which we continue to increase our numbers for all the posts that are in health, including for doctors. So you will hear that some doctors have finished, but they are sitting at home now. They are waiting for posts to enter into internship, because we do have an internship program. Maybe as I reach that point. So when you finish your medical school, whether it has taken you 5 years or 6 years or 7 years, you come back. Usually you make a choice. You can choose to do internship in the country that you are at. But I know that in some countries, the ones in Europe, like Russia, they will expect you to come back to your home country to do your internship. And then, but some countries in Africa will allow you, if they have space, to do internship in that country, in that hospital, which is still fine. When you come, you'll be registered. So our internship program in this country, after you finish training, is 2 years. So when it's 2 years, during the 2 years, you rotate into different departments. Usually you take 4 months in the different areas. 4 months in internal medicine, 4 months in general surgery, 4 months in pediatrics for children's ward, and 4 months in obs-gyne. And then you go into 2 months of HIV, like MOAT and TB. We have anesthesia for 2 months, which means they show you how to feel down, how to make them sleep and wake up. Then in psychiatry, that means for those patients who are unwell in your mind, you also have to rotate in that for 2 months. So this is how we've structured our internship. In total, it makes up to 24 months. During that 24 months, you get a small stipend to help you survive, not the salary of a doctor, but a stipend just to help you survive during this time. And then when you finish, or before you go into internship, you go into a registration for provisional, because you're going to touch patients. So provisional registration means just before you start to touch a patient, you must have a certificate from the Swaziland Medical and Dental Council. You can't touch any patient without that. And yet we know that during internship, you are like a doctor, but a junior doctor who is under supervision. But you have to put in Boma IV line, you have to examine a patient, you have to prescribe based on what you've learned from school. So when you finish the 2 years, you write an exam. They evaluate you. If after 4 months of your rotation you have failed, you didn't do well in that rotation, then you are going to find yourself repeating that rotation another 4 months, which means instead of 24 months, you are going to 28 months. And then after, if you do very well, yes, you want to ask?
No, sir.
So if you do very well, go internship, go to 24 months, then you are going to go into Batak Parela. They'll write for you an evaluation form, an evaluation certificate from the hospital in which you are, because internship you do it either in Mabane or RFM, but you're now opening up Good Shepherd, Latikulu, all the hospitals where they are specialists. So the specialist will write for you that this intern doctor did very well, can proceed to the next one. At the end, you collect that, it is taken to medical council, where they will look at it and okay it, because you need a certificate for finishing internship for when you want to specialize later. So you will use that certificate to go into the next study. Then the medical council will then prepare an exam. They call it pre-registration exam. That pre-registration exam, you will write it. It has an MCQ and a practical, which is called OSCE, or skills exam. So there they will have patients, show you things and ask you what is this, what's wrong with this one, how would you examine this one, and then they pass you. When you've passed that, then you are registered, full registration into. Now once you have a full registration, you go into a individual, unsupervised work as a doctor. But always as a doctor, you always know your position, that there are others senior to you, so you always take instruction from the senior ones so that you don't make a mistake. So after that, with our government, once you are employed as a fully registered doctor, You have to work 2 years, 2 years as a general practitioner within government, and then we offer you, or you can ask that you now want to go and specialize. When you specialize, you can choose any of the disciplines I've mentioned. You want to specialize in children, in pregnant women, or you want to specialize in internal medicine or general surgery. So there are different specialties in each of these 4 which you can take, and specialization is called a master's degree, MMed, Masters in Medicine, and then there's a bracket ophthalmology, which is for the eye. MMed in bracket general surgery, it means you are a general surgeon. MMed orthopedic surgeon, it means you are dealing with bones and fractures and all that, and joints. So, or any other specialty which you can do. And then government funds that one. We are able to fund that. You can go between 3 to 5 years. Any country in Africa offers postgraduate specialization for doctors. What am I leaving?
I think that's...
Yeah, I think I've summarized everything. It would be nice for you to just interact and then ask any questions that you might have. For some things I might have left out from this guy.
Okay, can I start off with the questions, and then you guys will ask, okay? I think we still have a bit of time. Oh yeah, we still have a bit of time to go. So my questions are, 1, are there other employers for medical doctors in the country besides government? And then 2, I see that there's a new hospital that's being built in Eswatini by the, is that the wrong question?
No,
by the
okay.
insurer. And if there are other opportunities like that are coming up, because they are 5 to 10 years away from actually qualifying as doctors. So what, if you cast your eye into the future, what are some things that they should be looking into? And then the last thing, last question is, a lot of students ask me about studying medicine with specific specializations. There's a lot of cardiologists here for some reason. Everybody wants to be a heart doctor. So if you could speak about what are the gaps from a specialization perspective, not even just for doctors, but even for nurses or other people in the clinical space. Thanks.
Okay. Yeah. Okay, you remind me. The good thing with the medical area, if you go into medicine, whether it is doctor or other, it's an ever-evolving kind of area. And also, opportunities from where I stand now, I don't know what might happen in the next 15 years, but I know that it's still growing in the country. So opportunities for work are not just government. I may be biased because I know more of the government system, but I know many doctors who have gone into non-governmental organizations. RFM is a non-governmental, Good Shepherd is non-governmental, but also private. Once you get that full registration, which I talked about, after finishing internship, you are free to go anywhere as a doctor, as a general practitioner. Some people usually even want to open a clinic, a private clinic, but I think the Medical Council has guidelines on who can open a private clinic or private surgery, as they call it, because I think you have to gain a bit of experience before you can work on your own. So the opportunities are there, but also what we've seen, apart from the NGOs, the private entities, that hospital is being built. It will also require doctors who anybody can apply, and I know that preference is being given to Eswatini. So those kind of hospitals, when they come up, they want to employ Eswatini. But there are other areas which I've seen our doctors being engaged in like projects, EMA projects, La Fandwa or PEPFAR, which is the American government. So we as Minister of Health are partnering with entities like PEPFAR, MSF, MSF, Doctors Without Borders. Yes, they call them Doctors Without Borders, but they've been helping in Chiselweni in some of the government facilities. They also hire. The PEPFAR is the American one, which has projects that work with us in HIV, AIDS, and TB. they're also hiring doctors to do certain things and work with the doctors hired by government. So there are a number of NGOs which are international where you can apply for jobs, whether as a nurse or as a lab tech. The adverts that came out recently, they're actually from money that is coming from the American government, not the Swazi government. But the applications are coming to us as Minister of Health, and the panel will form part of the panel for the lab, phlebotomists, whatever. And then when they pass, of course, their salary will be paid by the American government. So there are these opportunities that keep coming in the health sector for that. But also we are looking at, in future, if we are so saturated, like there are so many doctors, there are other opportunities. People can create different NGOs. We even one time we talked about taking care of people from their homes. Like if I have a mother who is quite old and is unable to take care of their own medication, like they are on diabetic medication or hypertensive, but they're at home and so old and are not living in the village. These are organizations that you can form into groups as registered practitioners and go and assist people with, of course, at a certain fee that people can register for. So I think when you come out of your trainings, you'll find a lot is changing. There's less and less reliance on government now. Yeah. Then what was the other question?
So which specializations are the gaps of in Swaziland?
I would say all of them. All of them we have gaps in specialization. So far, we still have a lot of foreigners in our specializations. We are trying to build the crop of Eswatini to specialize. So if let me go, if you look at general surgery in Babane government, we have 2 foreigners. We would love to have Eswatini coming in. So every specialty needs a local. I've heard that there's an interest in cardiology. Of course, you will realize that what you wish for now will be different by the time you finish medical school. So that is why you go through that whole 5 years of training plus 2 years of work before you decide what to specialize on, because cardiology is a specialization. But also, mind you, that cardiology tends to be a super specialization. So first you do your basic medicine, you work in everything you can. When you finish medical school, you can say, I don't want to do deliveries of mothers. I don't want to see children. I don't want to see AIDS patients. No. When you finish the first degree of medicine, which is called MPCHB or MBBS, you are, because the MB means Bachelor of Medicine, the CH is a Latin for surgery. It's true something. But the CH stands for surgery in Latin. But other countries will just say MB, which is Medicine's Bachelor, and BS, Bachelor of Surgery. So you have 2 degrees in one. That's how they used to explain to us. That's why it can take that long. So we then, after that, I was still explaining that cardiology is a super specialization. To reach there, you have to go through the first degree, work at least 2 years, then go into specialization, which might take you 3 years in internal medicine. Then once you finish internal medicine, they might add for you some 2 years for the cardiology, which is now a super specialization. Same thing goes for orthopedic surgery. You go into the specialization for 3 years in general surgery, and then they add 2 years for your specialization in the bone, because it's all surgery. So, but I know that as we go along in your training, you will change your mind. You're allowed to do that. Yes. You may find you love the kids, you love the mothers, you love the sick people, you want to assist them. Any other question? Catch a bit in the leg, there was a third one.
Okay, can I just say something quickly regarding study abroad scholarships? It's going to be very quick because you all know the answer. and then we'll take questions. Right, so medicine is a very, very expensive degree to study anywhere in the world because of the type of classroom that a medical student has to be in, right? It's a classroom that requires a lot of equipment, and even the teachers that can teach in medical school require a lot more experience and qualifications. So you might find, for example, I'm not saying this is an accurate figure, you might find, for example, that if you want to study medicine in let's say, vets, if you want to study any other degree, like let's say commerce, it may be 50,000 rands a year. Medicine can easily be 100,000 rand a year. So from a scholarship perspective, most scholarship programs don't put medicine because it's less students that they can sponsor if they sponsor medical students versus if they just sponsor any other degree. So in short, there are no scholarships to study medicine abroad. Abroad meaning, because for you guys, abroad is anything outside Africa, right? And it's like anything outside Africa, not only are there no scholarships, the entry requirements are even higher than Africa, and the acceptance rate is probably less than 1%. Because just like you see so many people in the room, it's even worse in America or Europe. Everyone wants to be a doctor for different kinds of reasons. So it's an extremely popular career, right? So even if you're able to pay for yourself to go and study in medical school because there are no scholarships, the entry requirements are probably the first hurdle as opposed to how you're going to pay for it. You should be very, very wary of any university that accepts you for a course in medicine, one with HCSE outside Africa, firstly, and secondly, if your grades are less than A stars or A's. If they accept you and you have B's and C's abroad, you should be extremely skeptical because that medical school is probably not one that is going to be approved by the Medical and Dental Council in Swaziland. And I'm saying this because there are lots of universities like that. You know, the reason why I put about Poland, about Russia, and about Ukraine is because there are these schools. In fact, there's going to be an event, I'm not sure where, but I've been seeing adverts in the paper where there's a Russian group in the country that is saying they're going to be offering students admission on the spot. You should be very careful about that. Those are the kinds of people who are not able to come back and work in the country. Because remember, when you study in Europe, you need to come and do an internship where? In the country. So there's the excitement. So that's in medical school, but I'm just letting you know that getting into medical school is a very difficult. So if it's very easy for you, and you have maybe one science like physics, like you don't have biology or chemistry, and your maths is a C and that kind of thing, I would definitely not recommend those places. Now, when it comes to studying in Africa, again, there are very limited scholarships. In fact, outside the government scholarship, I am not aware of any other scholarship program that covers medicine. There are many scholarship programs in Africa, like MasterCard Foundation, Alan Green Foundation. They always say, accept medicine. I'm telling you this now so that you know, because I know you guys are asking me. You don't read the fine print. They always say in the terms and conditions, accept medicine. Even those, but say the ones that are government to government scholarships like Mauritius, India, Taiwan, Turkey, except for Turkey and Taiwan, they always say accept medicine, right? However, if you and your parents plan this properly, it's not expensive to study medicine if you're looking outside South Africa and Botswana. So countries that are slightly have a higher standard of living than Swaziland are going to be more expensive to study. But if you go to countries like Zambia, Malawi, like we've said, it's actually affordable. It's cheaper than the most expensive high school in the country, right? So to do Form 5 in Waterford, for example, is 100,000. To do a first-year medical program in Zambia is 60,000. That is tuition, accommodation. Those who are in the medical group, you saw what that student said, right? She said it's about 70,000 for Lusaka Apex Medical School, right? That is how much it costs to go to Segelo High School, Larangwan. So it is quite affordable. So if you are really dedicated, speak to your parents about this. You know, don't feel like, educate yourself about the cost of studying. Because if I realize that some programs are affordable to you, but you just never took bothered to check how much it costs. To do a BSc at Uniswa per year it's about 20,000 or less. In fact, to do it, I was asking my mother because she teaches. If you go to Mbawana campus, she'll be one of your professors. I was asking her, so what is the tuition if I want to pay for myself, right? It's about 7,000 to 10,000 rand a year. Again, cheaper than doing A-levels in the country. So just think about it. I'm just giving you perspective, because if you can afford to pay for A-levels, you can afford to pay for a BSc degree, even though it's university and high school. But basically, if you're really committed, get that 250,000 rand loan with your parents and go and enroll. And you might find that you might not qualify for a scholarship first or second or third year, but there are many opportunities once you are a medical student. Once you're in the system, things that I may not know of because they're not relevant to students who are just applying from high school. I know for UCT, for example, it's a very difficult medical school to get into, but once you're in it, there are many fellowships, merit awards, these just small bits of money here and there that can actually add up a lot. So if you are able to get in and you're paying for yourself, you might find that by the time you finish, you're paying less money because you're great students, or you've done volunteering, or you've done so many other things that have reduced the actual cost of study to you. So that's my bit on scholarships. I'm going to hand over to you. And if you also have any questions for me, you can let me know as well. All right?
Yeah, just to add, so that you are not surprised, the Medical and Dental Council had to compromise and accept students coming from Russia and Ukraine. Although some of the universities, they are not approving of them. So what they've done now is that when you come back with your degree, you have to send your papers to an organization called ECFMG. It's in the USA. It verifies medical universities, whether they are authentic or not. So that is the new practice now. So we might find that if you go to whatever university abroad, because I did hear that it's even cheaper in Russia, they're able to pay, that you might find you go out there, you find a university that is in some corner somewhere, and then when you come back, you present your papers, the medical council says, we can't even register you. And when you try to verify your university's authenticity, you find that it is not authentic. And unfortunately, when the rules are set, they can't be bent for one person. So for now, the council has allowed all those who have studied from Russia, Ukraine, to come in and register. But we had to strengthen our internship program to make it very strict and make sure that people are able to work, because there were a lot of problems initially. But now it seems it's doing very well. Even those who studied there have caught on. So I think it's okay.
All right. Questions? I think we will take them in batches. I'll note them down for you. But any questions? I know you have a lot, so please don't be shy. Yeah?
You had mentioned that the government, I'm not really sure who, but there's a small stipend when you are an intern. Yeah, it's what how about if you decide to intern in another country? Because the little knowledge that I have, the agreement that you have with the government is specific to a number of years of schooling, which would make it 6 years, 5 years, which doesn't really do the internship.
Yeah. Maybe repeat the latter part of 5 years, 6 years.
Medical degree is 6 years in maybe South Africa.
Yeah.
But the government, when you make an agreement with them with scholarship, is relative to how long the duration of the program. Now, the internship is not inside.
Yeah.
So I was asking concerning this because you made mention that the government taking into the end wasn't.
Yes.
If you were rich.
Yes.
What about if you're doing your internship in another country? How does the...
Okay, so the internship is such that, good question. The internship period is such that when you finish your medical training, let's say you were training in Vets University, the Ministry of Health or Department of Health of South Africa will then offer a number of positions for interns to come to apply for. So when they do that, anybody who has trained within the country can apply. But of late, we've seen that they don't allow foreigners to go first. So they first want to finish their own South Africans in terms of entering. So once they do that, it means they will pay you. Once they offer you a position of internship by the Department of Health, you'll be paid by the Department of Health. Then if they reject you and say, like what we've been saying of late, then you come to us. We also offer you a position with a salary or stipend, which you will take for the next 24 months. So you understand? Did I miss anything?
Okay, any other questions? Yes, go ahead.
I'm a bit concerned about the focus, as a follow-up question about the focus into the medical field. So maybe I know it's just a projection, but then perhaps it might just play into the picture for somebody maybe wants to do, let's say, neurosurgery or what. But then it's like, the question is, looking at the current dynamics, how far do we go as a country in the next 24 years in as far as the medical field is concerned, in terms of courses you think would be in demand in the future, and some other new emerging markets into the medical field, looking at the way that the awareness of that, looking at the awareness of the people, looking at how we are developing.
Okay, yeah. We can see in the future, already we are seeing trouble with cancers. We see trouble with cancers, and we don't yet have expertise for that. And so when I talk of cancer, that's just an area. I talk of a wide range of services around cancer that range from lab to radiography department, to nursing, to even the doctors themselves. So in the next 24 years, that's an area I think that I feel we are going to be pushing by hook or crook, because cancers are on the rise, and as we have suppressed HIV now, we see cancers and non-communicable diseases. The non-communicable diseases include cardiac disease, or hypertension, which means high blood pressure. It includes mild diseases of the respiratory system, or chronic obstructive pulmonary, because as a single timer factory, we are polluting our air, people will get COPD, chronic obstructive bronchitis, and all that. So NCDs is one major area, it's a big area. Mental health is within NCDs. Mental health, people are getting, there's too much pressure, I'm not performing, I don't have money, suicide tendencies. So there's a lot of cadres that you can imagine there. And then also injuries. We see injuries also. Many people driving cars, the numbers of crashes is increasing. But then now it's difficult for me to say now in terms of specialization, which areas. But I think that we will need specialized MSWAT. So yes, you can go in and do your basic medicine, but then quickly you need to be thinking which area of specialization, because when you do the internship, you will then realize, you see, what are the problems in the country. That makes you decide, okay, I think I want to be a psychiatrist, because I can see people are really disturbed mentally. Then you have a medical physicist who calculates the dosages in physics, the beams when you burn the cancer cells, you calculate, remember those things? Curves. If you like physics, then medical physicist is one area that you can do. You work alongside the doctor, you work with the system in cobalt 60 machines that burn cancer cells, cancer of the cervix or any other cancer. Second example, that's just an example of one area, cancer of the cervix. If you go to cancer of the prostate, which is the first one in the country among men. It's the leading cancer among men. Prostate cancer, for it, you require a urologist. A urologist is we usually call them plumber. It's a plumber. So it's the opposite of a woman. For the men, the urologist takes care of the whole urinary system of the men. And then that one is the one who will deal with your prostate, remove it, and then they have to work with the radiation oncologist again to give you certain medication to kill the cancer cells and all that. So cancer is big and it requires many, many more specialties than we think. Then of course the other NCDs, diabetes is usually internal medicine specialist can do that. But when you come to, when your kidneys are destroyed because of NCDs or non-communicable diseases such as hypertension and diabetes, you require a nephrologist. Nephrologist will help your kidney to dialyze artificially, like what we have in Mawane government. We have 2 nephrologists who are Swazis, and they are helping people to clean out their kidneys, which kidneys have died. So that's another super specialty from internal medicine. Yeah. So these are the areas and many more. Yeah, go ahead.
When you introduced yourself, you said that you first went to do BSc,
Yeah.
and then you went before you enrolled to the medical school in Uganda. So I was wondering, did you actually have to do the 4 years before you enrolled to Uganda, or did you 1 year to apply?
Okay, interesting question. Yeah, you know, when I did BSc, I was half-hearted, of course, because I really wanted medicine. By that time, we didn't have A-levels except St. Mark's. That was the only school then. So we had to go into BSc. So in BSc, I didn't do quite well. I just got a pass, not a 2-2 or 2-1 or what. I just got a pass. I said, "Ooh, finally, I'm done." But even if I had gotten a 2-1 or a first class, that the East Africa system is such that everybody starts from scratch. But I know some universities which you'll apply to, which will tell you that since you have done this degree, you may start in the second year. But for me, I always prefer to start from the first year with everybody. Because what I found is that the courses are so different from what I did in BSc. For example, when I was in BSc, we did physiology. Physiology was, we're doing more starfish, starfish from the ocean, we were doing frogs, we were doing rats. I mean, the human body is not like that. Unless we are going to do the BSc as then you continue into research. That's fine, because you use frogs, you use whatever. So what I found is that the physiology of the human being is much different and very interesting. So I just said, thank God, no one told me to start in second year, because maybe I wouldn't have appreciated. So I started from scratch. But some universities will allow you to start in the second year. But if I were you, if they take you, I would say don't rush. Just start with everybody and go up with them. Yeah. So I did 5 years medicine in Uganda on top of the 4 years.
And then a 2-year internship.
Oh, by the way, so the other thing you need to know is that be patient. Don't lose hope. Because don't say, immediate no. So for me, I was patient. I did the 4 years. I said, okay. Some friends of mine, they dropped off in the second year and went to University of Zimbabwe because their grades were very good. So UZ used to take people at second year of BSc. If you have a first class or upper second at the end of second year.
So 70% and above. That's
Yeah.
what that means.
So for me, I was down there in the 60s and 50s. So I said, let me finish my degree and get my certificate and think what next. So I finished it, graduated, and I even had to go into teaching. So you can imagine how old I am now, then at that time. I finished at 21, I taught for 3 years, By the time I went to study medicine, I was 25. I finished when I was 8. But I still felt energetic. I felt fulfilled. I was happy with my career path, how it went. So no need to rush. If you find yourself being sidetracked and you're doing BSc, just do it and keep applying. Teacher, what was the question?
I think you answered it. Okay. Did you have a question? The front? No. Okay. Anyone else? Yeah, go ahead.
My second question is based on how, like, the government tries to level the playing of research in Swaziland. Because I think as much as people who are interested in medicine, we do have others who, over and above, like, being doctors, would like to go deeper into research to kind of try and get as much as they can for Swaziland. And so how is that landscape in Swaziland and how we're expecting to improve it?
Yeah, we do have, as Minister of Health, we've established a National Health Research Unit. So we are aware that some of you in the future will want to do research. Research we've already been doing myself. I didn't tell you that I then did a master's in public health. I didn't specialize in clinical work. That's why I'm now at the offices, because I did a master's in public health, which gears you towards research, administration, and other things, policy decisions within
You should
health.
tell them where you did your master's.
I've been forgotten. Yeah. So imagine after going all these parts and feeling like I'm late, I was accepted at Harvard University for masters of
From a pass in BSc to Harvard Masters.
Yes. So in the end, you can see that as you apply yourself in life, you will make, you'll get paid up for the. So I did my master's in that because I was now looking at research, doing research activities, and also influencing policy decisions in the country for health, and also administration, like looking at how people are working and all that. So there is a possibility of going into that, and that is why we have these partners like the American government, the Labo Doctors Without Borders, Labo ICAP. There are so many organizations. If you see cars moving around with emblems, a Ministry of Health emblem, and an organization's emblem, usually those are helping us in research. So the strongest research so far is within HIV. So these organizations would hire doctors to conduct HIV research. And these research results we have been disseminating in different countries. I worked a long time in HIV program for 10 years, which meant I did a lot of research. So I've been a principal investigator for a number of research studies. And that has opened my opportunities. I've traveled widely. Many continents I've been to present papers on behalf of the country. Because here's a research we did in HIV, here's another one. So they invite you to come and do presentation, fully funded, everything. So research is interesting because of that. You find yourself traveling a lot and meeting different experts. So it's another area.
Did you eventually work as a doctor, like in the hospital?
Yes. So when I finished the internship, I worked in Uganda for 3 years. And then here in Swaziland, I worked maybe for a year, I think. Then I was taken into the program for HIV, for introducing the new ARVs, because these were drugs that were new. They were not in the country or in Africa even. So every country was set to establish a system of introducing them. So that's where I worked for 10 years after studying, before I went to headquarters. So there's a lot of things to do.
Go ahead.
So I have a question. Which course can you do in Swaziland as a convention? That is production, nursing, or BSc?
That's a question we get a lot. So for students who want to do medicine, should they do BSc in nursing or BSc in biology chemistry?
To be honest, I wish I had done nursing before, than BSc, the one that's offered, BSc biology chemistry. Because when in nursing, the courses are very, very similar to the ones for doctors, except that they tend to divert their attention towards their task, because nurses have a specific role that they need to do, is to take care, is to nurse a patient. So then a large portion of their courses will then focus into how to take care of a wound, that is for bandaging, how to inject, how to do this and that. Although as a doctor you do study how to clean wounds, because you also have to know how to clean a wound, how to inject, how to put in a drip. So there are lots of similarities. So when you're a nurse and you go into medicine, you find that you are not too much in you are not lost too much, because you find that the things you've already studied, but maybe they were touched on a little bit. Then in medicine, and studying medicine, you go a bit deeper, much deeper. So for me, I would have chosen to do nursing if I had known.
Does government fund students to study nursing outside the country? Because our nursing schools are also, like UNESCO, for example, takes 50 students per year. I think SANU takes a little bit more, so but definitely less than 500 students. There are definitely less than 500 spots for students to do nursing in the country from these three schools, UNESCO, SANU, and Christian.
Yeah, but government funds
nursing outside?
No, not outside.
Okay.
Not outside. Not outside because I think their concern is that, okay, when you train people, the demand for that cadre is shown through they are being absorbed quickly into working systems, and then there's a need for more to be produced. But since whoever are there are being trained, for now they still remain at home unemployed. So government will not make it a priority to find a nursing course outside. And also, I think there was a mistake that was done by training schools of allowing huge numbers to be enrolled. There are certain numbers that you can manage, because these sciences require you to admit a number of students that can fit in a science lab at one point. Each person has, or they share two, but not to have a crowd of 10, sharing a microscope, for example. So, which is what then influences the numbers that they can take in the nursing schools. So government will not fund outside, unless if the country has absorbed all the nurses from the system and there are not enough that have been produced, then they would send others out.
All right, go ahead.
I may be wrong, but there are some specializations that you can't get with a qualification from a university. For instance, being a trauma surgeon, you get that accreditation not because you went to a school, but you went to get into experience. Now, you had made mention of a freeze in hiring people. Now, what if I come and I say that I'm a trauma surgeon from some hospital in somewhere? Will you hire me?
No, we want as much as possible for the specialists. We push our way. If it's a Swazi coming with a specialization and we need it, we are going to push Ministry of Public Service to give us even that one post at that time. So I've seen a few that have come back and we've been able to employ them, but they are not many. But if you come as yourself, usually we push for you. But I don't think it's right to say there's no training for a trauma surgeon. There are specific trainings for a trauma surgeon. So you can choose that you want to do that area. Or others now, there are other areas called emergency physicians now, which we want to make sure we have also in the country. Yeah. So that's a relative question. It will depend on that situation. But at the current moment, we make sure that when a specialist comes back and is a Swazi, we push our way.
All right. Can I just pose a question while we are all thinking, because you've just added a lot of information. When I speak to students who are Ngemaswat, who've gone to study outside the country, studying medicine, so the people who are basically living your dream, right? they're saying, you know what, I wish I had looked in another area of the medical field, because being a medical doctor, this is why I pulled this up, requires certain personal characteristics, like ukuthi umuntu lonjani. Uma sekunesivumbulo ambi kwakho, you know, are you the person to do something or to run, you know? So
Sure.
yeah, so
I
please
think
talk
we
about
never
that.
think about that.
Yeah.
We never think about that. But what I learned from East Africa is that how they sifted, helped you to sift yourself quickly out of medicine, was the very first week, you go into a lab and you find cadaver, dead bodies. Well, we have
You're in the wrong group.
it's not like they're scaring you, but it's just how you're going to work from that day onwards for the next 2 years, because it's a 2-year module that's called anatomy. So, but our anatomy was using cadavers. Cadavers are the mummified dead bodies. So each one, so we were 3 per body, so you go into a lab with these cables and these bodies are covered, and then they tell you to open them, and they tell you this is your body, you'll be working on this body for the next 2 years. And so you'll be doing exams, you'll be doing, so there's a manual that you'll be handed with, scalpels, gloves, your dress code, then you start from whatever part they want you to start, maybe the limb. They just want you to dissect, open, check, look at the muscles, look at the vein, then they tell you what vein this one is, what artery this is, what does it do, and all that. What type of muscle is it, what's the name of the muscle, what does it attach on the bone, and then you open, what bone is this, and all that. So by the time you finish your 2 years, that cadaver is really is shattered, because you have cut it and cut it. You remove the heart, you put it out there, you remove the brain, you put it on the table, and you study the different parts of the brain using the manual. Everything, every organ. You remove the uterus, you look at it, you dissect it. So in the end, what we noticed is that those who went there half-heartedly, because maybe the parents said, go and study medicine. I want my child to be a doctor. They just resigned that same day. So they go to the lecturer and say, please, may I leave this course, or may you offer me another course? And they help you, they assist you.
This is a really important thing, because like I said, you can get into medical school. Let's say you've done all of that. The rate of students who will finish the first year is lower than the students who actually start. So instead of you wasting your time knowing that, okay, besides the glory and the fame of being a doctor, I can't hold the scalpel and cut, you know, make that decision earlier. A lot of students, but I'm not saying this to discourage you, but I'm just being, it's the same thing with engineering. People want to be engineers and then they find the math and like, you know what, I think I'm going to go into something else, right? These are extremely difficult courses that you want to do, mentally, emotionally, so you really need to prepare yourself and you really need to be committed. It's a very special field. That's why I think it's so admired. You really need to be a certain kind of person to do well. I put a slide there about clinical and non-clinical careers, right? So even if we're looking at nursing, it's the same thing. There'll be cadavers that you need to work with because that's the job. If you can't work in a clinical setting where look at medical careers in a non-clinical setting, which is where you're not dealing with a patient, but you're working in a lab or you're working, you know, in a research function or something like that. You need to be a certain kind of person. There's a high level of dropout in even the best medical schools in the world because we don't talk about this. We don't talk about how difficult it is for a student, for an 18, 19-year-old, 20-year-old to be in that kind of situation.
I think to add to that, even just the work environment is very, very stressful. When you are working in the medical field, people expect a lot from you. And people forget that you are also human like them. So as you can see that in newspapers, ministry or health sector is always under fire. So which can discourage you as a worker. You can start feeling like, most very much and then you tell your mother pass. So you must have a certain character, conscientiousness. Okay, I'm doing this for the person. If I can assist even this one person in front of me, let me do my best. People die in your hands and you'll be blamed. Sometimes you'll be taken to court. And you are not trying to do any harm. You have to prove in court, it has to be proven that you were trying to do no harm, because there are these different, the Hippocratic oath that we take at graduation, which highlights different things, including at the first instance, my attitude is I want to assist this person. So if I make a mistake, then I must be judged accordingly that I didn't come in to kill, but the person died in my hands for whatever reason. So like we had an intern one time, an intern doctor who did a cesarean section and ended up cutting the cheek of the baby because the baby was lying in a strange way. Normally they lie with their this cut. So when you cut, it's around the area of the neck, so there's water there, in between the uterus. But she cut the cheek. So in the end, she had to be defended. This is a doctor who didn't wake up in the morning and say, I'm going to cut the cheek of a baby today. So I think at your conscience, always have that, because then when these mistakes happen, you can be defended. So there are so many things that you need to have. Honesty, your own health. If you know that you are a person who easily collapses when you are under strain, or you have palpitations, anxiety disorder, that anxiety where you start breathing, then please don't consider medicine, because there are so many things that will make you anxious, and you can collapse in front of the patient, because instead of assisting the patient,
you become the patient.
Yeah. So you judge yourself carefully, if you can, and then long working hours. Although everybody's complaining, hey, they're just eating government money with overtime allowances. They are actually on the roster. They can't sleep. Some people's families may be destroyed because of that. Because you are sleeping. Hey, come to the theater. You are needed. You have to go. Wake up and be alive and go and operate and save your life. There's nothing like, no. So I think there's a lot of demand and strain that is put on this kind of cadre, medical cadre.
Yeah, go ahead.
If maybe you get accepted for a scholarship to go study medicine, and then in between the course, like what
You want to change?
I want to change. Is it possible?
Usually, I've seen it happening.
For government
What
scholarship.
happens with the scholarship?
Government will
The thing is,
government will not say no. If you drop out, you drop out.
Yeah.
Government is a bit
Yeah.
tough.
Yeah.
Money, it's like if your parents pays for you the first year and second year, and you think you will ask for third year, they usually it's become difficult.
Because you've been paying all along, so you should.
So it's like you should start with government and start with government.
Yeah. So
unless you have like specific health problems that you can provide
Make a
proof
case
of. Would
Yeah.
say I couldn't continue because maybe I have weakness in my leg, or
you have an injury or health
or the
issue.
doctor can say your mental state has deteriorated for whatever reason, or is not compatible with the work that you're doing.
Yeah,
But I
because
mental state out of plan. You can have
just stress.
You can have severe stress to the point that you can't cope with that. And then an expert can assess you and give you a written report. I think the government wouldn't be so unfair.
Yeah, scholarships, it changes from scholarship to scholarship, honestly.
Yeah.
This is where it's important to read the fine print. To know before what exactly are you taking, But there's no one answer for every scholarship. Every scholarship will have their own system. Because in this situation, this is our policy. In this situation, this is our policy. But yeah, like she said, unless you can make a really strong case, not because you just feel like it, you just feel like the situation is only in America where they have a liberal arts system and they allow you to change courses up to a certain point. But in the schools that follow like a British system, especially where you applied for that particular course and then you want to change, I think it's a bit more difficult. Like in South Africa, for example, if you were accepted into X degree and then now you want to change to Y, it's a difficult process to go through. Beyond talking about it from a scholarship perspective, just from changing your admission from one department to the other. So it's better to ask these questions prior. Before you cite anything, you take anybody's money. Ask these questions prior because it will not be easy. It will not be easy to change on the other side. Yeah.
Actually, for medicine, the university I went to, it had two parts for the medicine. There was the first 2 years where you did the basic, like for embryology, anatomy, physiology, pathology, just the basics. Then after these 2 years, you do an exam that qualifies you to go to the next level, which is third, fourth, and fifth year. So from third year now, you start going to the hospital. So you will have some lessons in class for maybe two periods, maybe 2 hours. Then the rest of the day is bedside teaching. So they take you around, then they roster you to see patients with the other more experienced doctors. But they know you're a student, so you have a role that you know you're supposed to have. So, but once they used to say you can drop off within the first 2 years and they will consider you for another course like pharmacy or another. But once you go into the clinical, you just have to start with it because they will not drop you off. Because now they're saying once you start learning how to examine a patient and diagnose, you will become what we used to call a quack doctor. A quack doctor is somebody who is trained but has not graduated. But in countries which are big countries, they hide in the villages there and open a small surgery or clinic and start treating people without, because already they know the anatomy, they know the physiology. So once you pass the first 2 years, you enter your third year, and for some reason you're not doing well in the third year, they will not fail you.
Yeah.
They will in fact, you'd rather repeat. They will not expel you or allow you to leave.
So look at the admissions of that particular university. So UB, for example, has a system where you do BSc first year and then second year. If you meet certain requirements, then you can do medicine or you do another health science course. Whereas in other schools, like if you go to Lasaka Unpacked Medical School, they are teaching MPCHB. There is no other course that you can take if you don't do well in that. So look at what a medical college offers versus a university offers, and look at the department, and then if you know yourself but you just want to try, then you have a bit more flexibility from an admission perspective. But then always keep in mind that from a scholarship perspective, it's going to be a completely different process. Yeah. Any questions? I think we're going to nearing towards the end of our presentation. Any lingering questions? Okay, one question that I wanted to bring to you is that because students will not have a lot of visibility about being a doctor in the real sense that we've been talking, and they'll go into these careers or into these degrees not having a lot of context. What can they do now in order to bridge that gap? Is it possible to do any kind of job shadowing? Are you able to volunteer in a clinic just to be in a clinical setting to see what's happening? Are there any other, besides the links that I've shared, are they able to go to the medical and dental councils and ask them to come and present to their school? What are ways that students can sort of just know more about the health system in the country and about being a doctor and other careers that they may not even be considering? How else can they get that kind of information?
Okay. So there are different aspects different ways to answer that question. One, we all have different roles. So the Medical and Dental Council is introducing what they call student indexing. So they are trying to increase or improve your knowledge before you even go to study on what you need to do. And also have the opportunity to inform them that you've been admitted to a certain university before you even accept and prepare yourself to go there. So there's a role of the medical and dental council, and when you are already admitted and studying, the student indexing means they register you as a medical student. Then at our level of the Ministry of Health, we take walk-ins. So if you come to my office 207, you ask for Dr. Okello. Anytime I've entertained students coming with their parents or even parents wanting to ask specific things, you can come to my office, but also I can share my number that you can use for that information. And
where's the sign-up sheet? Just make sure you sign up so that I can share her details via email and some of the other resources.
Email, you can write me an email, you can send me a WhatsApp for the specifics. But the other thing that we are allowing is for you to schedule. Some students have come to me asking for a job schedule. I say, fine, I talk to a doctor and say, please, can you look after the students? They want to follow you wherever you go. If it's a surgeon, you follow the surgeon. When they scrub, you go in, you also scrub. We show you what to do. You also stand there and watch. And then you hear how they converse, how they talk, what they do within that sphere. And then, so we allow that if you come and ask individually as yourself, as a student. But what I've seen is that a number of universities have demanded a letter from us that shows that you have shadowed. You have done at least, some people say a month or 2 weeks, you have been attached to a health facility. So normally, in those cases, when they've accepted you and they give you that demand, you come to my office and we write you a letter, we introduce you to your nearest hospital. If you're in Manzini, we introduce you to RFM. If you're in Mabani, so that you don't have to go up and down. Then we introduce you. After that, they will write you a letter that they will stamp as a hospital, and then use that to produce to them. But usually, even before they do that, for your own sake, if you're really, really, really interested in medicine, you can ask during one of your holidays to come and shadow, and we can talk with the individual level. Yeah. But from what I've seen, most students who really want to do medicine, they really want to do it.
Yes.
And when they really want to do it, even the dropout rates are not so high. Because then you realize that it's tough, but it's not tough to only you. It's tough to everybody. So you are not just a girl in the class. So you find that you feel that I can continue because all of us are crying. Today you get 40, next test you get 70, others are getting 20. So you start feeling like, okay, I'm not so bad. Let me continue. It's part of the struggle. It doesn't mean listen, you are done. It just means there's just too many things to put in the head at one go. That's the problem with medicine. There's a lot to learn, which makes you forget. But as you grow into the field, things become automatic. So even me now, I'm sitting in the office. If you tell me now, here's a person collapsing, I know what to do, even though I haven't done it in a long time. If you give me, put a drip, I'll put it down. Although I haven't done it in years. So it's just embedded.
All right. Any final questions? We're about to end our event. I know some of you are going to wait for the event to finish, then you come up. And your question might actually benefit other people. So any final questions, any final comments? Is there a doctors association or something like that that is functioning?
Yes.
Yeah.
Okay, there is a doctors association, but I wouldn't say it's as active as those that I've seen in other countries. But they do have a WhatsApp group. Discussions take place there. Issues are discussed. It has around 245 doctors in that group who are all local. So the issues are discussed, issues of concern, questions. Even us Ministry of Health doctors are there, even private doctors. But they wouldn't, of course, allow somebody who is not a registered doctor.
Okay. So yeah, any final
but
questions?
their role is not so active in terms of guiding.
Oh, it's more internal. I
There's
understand.
more issues there.
All right, if there are no questions, maybe just final words from myself and Dr. Okello, and then we close. I'll start because yours is going to be more important. So basically what I'd like to say to you, the reason why we held this event is not to scare you. I know some of you, half of you are like, you know what, thank you very much. I think I'm going to try something else, right? That was not the intention of this event. It's just that based on the questions that we get at TKI, we are aware that as students, you don't have enough information about this career that you want to go into. So for me, what I would like to say to you is that the best thing that you can do yourself is get information. I've listed some resources on this document that I've created. I've put a bunch of other resources on the WhatsApp group. We did a study 2 years ago that lists all the medical schools in Africa by country, by region of the continent. Please take the time to educate yourself. It's one of the best things that you can do as someone who wants to be a doctor or who wants to work in the medical field, okay? It will just help you a lot in the process, and above and beyond that, it's really going to help your families, because being a doctor is definitely a family commitment. You cannot be a doctor alone. It's a very rewarding career, but it's an extremely taxing career from the application process going on, right? So educate yourself about, studying medicine. Get 1 or 2 friends. I see there's a lot of students from St. Mark's. The students who want to do medicine in St. Mark's, become a group and make sure that you invite people like Dr. Kello, TKI, Ministry of Health, ESHEC, and any of the other bodies, or even just doctors. Doctors, we've heard that there are 2 nephrologists in the country. Invite them to come and speak about, just be active, because the people who want to be doctors, if you create that environment around yourself, you will actually become a doctor. It's not going to be like, I want to be a doctor, but I don't really believe it's going to happen, which is another group of people that are in the room, right? So if you do all of those things, it's going to become real. And not beyond that, it's going to become practical for you, because you will know what you should do and what you should not do in this 10-year long process that you're preparing yourself for. So my key takeaway point, inform yourself as much as possible now or as you're going through the application process, so that when you get to medical school or as you're going to medical school, you have a support system around you. And
thank you for the opportunity to brief you on this, and that I know that there may be other questions that will come up when you are on your own. Remember to seek help, call or WhatsApp is better for me. Just a quick question, I don't mind answering on WhatsApp. And also, then we can make an appointment if you need to discuss further. I can give you. And so if you are really, really convinced that you want to be a doctor, then please don't lose hope. Just continue pushing on and ask for help where needed. It is possible, it takes long, but at each step you will feel rewarded at each step that you take into becoming whatever specialty that you want. Okay, thank you.
all right, thank you so much. I hope that you have a great rest of the day. And thank you to Dr. Okello for taking the time out of a busy schedule to be with us. So the event is done. You are free to hang around, ask questions, go home and study, whatever the case may be. But thank you for coming.